there. Today we're going to talk about pertussis, aka whooping cough. We're seeing an outbreak in the United States right now, and Oklahoma, where I live, happens to be number 2 as far as incidents so far. So what is whooping cough? It is an infection caused by the bacteria Bordetella pertussis, and it has a very distinct cough that goes with it. People will cough so hard that they throw up. It's called post-tussive emesis, but this inspiratory that they do before coughing is the whoop that we hear. You can Google it. It's pretty alarming sounding when you hear it. In some parts of the world, whooping cough is called the 100 days cough because once the coughing phase starts, it lasts about 100 days, give or take, a few weeks on either side, but 3 months or more. Once the coughing phase has started, there is not one thing we can do to make it go away any sooner. The Bordetella pertussis actually does damage to the ciliated cells in the lungs, and so they have to heal, and it just takes that amount of time. We can potentially shorten it to maybe 6 weeks if it is caught early on. The problem with pertussis is that in the first couple of weeks, it can resemble all sorts of other respiratory infections. So you have to have a patient and a clinician who are both very astute and aware that pertussis may be around in order to catch it. The only way you're really going to notice this is that cough or coughing so hard until you throw up. You can also do a nasal swab, similar to the one that you would do for COVID or flu. Usually people who have pertussis don't look super sick. They might get a low-grade fever, but they generally don't feel awful. There are 3 phases to pertussis. The first couple of weeks is called the catarrhal phase, where they have respiratory, just vague, nondescript symptoms, but sometimes have very bloodshot appearing eyes, or what we call injected eyes, and occasionally excessive lacrimation or tear production. So if you notice that, it may be worth getting tested for pertussis or going ahead and treating for it in the hopes that you may save 100 days worth of a cough. The second phase is the coughing phase, and then you have the convalescent phase, which is a couple of weeks at the tail end where things start to get better. If caught in those early days by the astute clinician and hopefully the very involved patient, we can potentially shorten that cough. The antibiotics that we use are azithromycin or a Z-Pak, clarithromycin, those are both in the macrolide class of antibiotics, or for people who are allergic to those or who have drug interactions, you could use good old Bactrim or sulfadrug. The biggest issue with pertussis is not the 100 days of cough, which is very inconvenient and people look at you like you're going to pass something on, which you are because it is incredibly contagious for about the first 3 weeks that you have it. But the risk is that we pass it on to people who are more vulnerable, especially little babies or people with underlying lung disease or the elderly. So how do we prevent this? Well, just like many other vaccine-preventable diseases, we prevent with a vaccine. One of the issues is that for those of us who are vaccinated, the immunity appears to wane over time. So if it has been 10 years since you had your Tdap, we get that in combination with the tetanus and diphtheria booster. You get that when you're pregnant, or if your partner is pregnant and getting ready to have a baby, they want everybody to have the Tdap so we don't pass the pertussis on to the little baby. If you haven't had it, it's a good idea to have a tetanus shot anyway, and they come combined. So that's our best bet. Also, sick people stay home until you're not running a temperature anymore. I can't harp on this enough. We would pass on far fewer respiratory infections if we just use a little common sense. If you should happen to get pertussis, our main concern in most people is that you might go on to develop pneumonia and require hospitalization. In very severe cases, of course, that could progress to death, but hopefully we catch it before that happens. So the last big resurgence of pertussis was around 2018. We're seeing numbers this year that look like they're going to surpass that. So just be careful. If someone has been coughing for more than 2 weeks, there's a decent chance that it could be pertussis. A lot of people don't go in to get that tested because they don't feel that sick. So If there's a concern, of course, you can get tested. After about 3 weeks, you shouldn't be contagious anymore. But remember, once you start that coughing phase, you're going to cough probably for 3 months. And yes, you're going to call the doctor's office and say, I'm still coughing. And they're going to say, there's still nothing we can do about it. And then in another couple of weeks, you're going to call and say, Doc, this cough is driving me crazy. And we're going to say, I'm so sorry, but there's still nothing I can do to make it go away any faster. And then one day you're just going to wake up and it's going to be gone. So get yourself vaccinated, please, especially if you're going to be around vulnerable individuals. And stay tuned. Don't forget to like and subscribe.